Hi, it's Nicole here from Canberra Ingrown Toenail Clinic. Thank you for watching this video and also congratulations on your successful surgery of your ingrown toenails. Now we wanted to give you this little video to remind you of what your podiatrist went through with your redressings during your treatment. So you have already been told this information and given a post-op instruction sheet, but we thought we'd just do a little video to actually show you how to do the redressings yourself. Now, please remember that if you have increased redness, pain, swelling, pus, discharge, excessive bleeding, these are all things that you need to come back to the clinic for. So please call us if you have any of these things. Otherwise, if it's all traveling nicely, then just follow these instructions that we'll go through with you now, and then we'll follow up with you at your 3-month post-op check. Thank you. Okay, so the first thing that you need to do is remove the dressing that your podiatrist put on there a couple of days ago. And I want you to grab a bucket or a bowl, ice cream container. Just make sure it's really well cleaned out with disinfectant. And every litre of water, you need to add a tablespoon of salt, just your regular cheap table salt. So pour that into your lukewarm water. So I've got 2 litres of water here and 2 tablespoons of salt. And then all you need to do is submerge your toe in the water and give it a good swish around. Probably let it soak for 5 minutes. And that will just help to break down some of the, yucky skin that might still be on there. Get yourself a face washer or a flannel. If you have some gauze or something like that, that's great. You can throw it out, but otherwise just use a nice clean face washer. So after you've let it soak for 5 minutes, you just need to get your toe where your ingrown was removed and just gently wipe away any excess sort of skin or dry blood that might be there, just like that. Now you need to do this after it's been wet. So for example, if you've been to work all day, you come home and you have your shower. After you shower, change it. Leave your dressing on until you do it again the next day. If you're a person who showers in the morning, then have your shower in the morning with your old dressing on, and after your shower, have your soak and change your dressing. So basically remember, you don't want to keep a wet dressing on your foot because that is a sure sign to get an infection. So once you've done the 5-minute soak with the salty lukewarm water, dry off your toe, and then you can put your sterile dressing on that your podiatrist has given you in your dressing pack. So one of these island dressings. You don't need the big dressing that you've had on the last couple of times. So basically all you're doing then is opening up your dressing pack. Try not to touch the island part that's going to be on the wound. So try and open it up without touching it, and then wrap up your toe like so. These are hypoallergenic dressings as well, so if you have an allergy to tape, it's not going to affect you. And then put on your, if you feel like it, if you feel like you need a bit of extra protection, your little tubey foam that your podiatrist has given you can just go over the top. Ta-da! And then you're right to go about your day. All right, so please remember that this needs to be done every day. It can't be wet, so as soon as it gets wet in the shower, it's changed afterwards. Keep it dry throughout the day. If you sweat a lot or you're in a job that is you're quite sweaty, then you might need to change this dressing during the day. You don't have to do the soak at work, but you might want to take some dressings with you to change it during the day. Now, any signs of redness, pus, swelling, increased pain, increased bleeding can be signs of infection, and that's when you need to give us a call. Otherwise, within a couple of weeks, this should be looking good, and we'll catch up with you at your 3-month post-op check, and we'll go from there. All right, thanks for watching. Bye.